Dr. Roger Massa.
And I'm Dr. Tyler Dickinson.
We're St. John's Chiropractic Clinic here. We'd like to show you our new table. We're really excited about it. For years you've had flexion distraction here for the lumbar spine. Now we have one that does the cervical spine. This table does a lot of really nice technique that you're gonna, very comfortable, very effective technique. We'd like to demonstrate and show you how it works. So what we do, we start with, we open this little lever here, and this is flexion distraction. So this flexes and also distracts each segment wherever we want. So we move up and it creates a negative distal pressure at the segment where we're contacting. Very gentle, very effective. Also does lateral flexion, so we contact and we mobilize lateral flexion. This is really nice for fixation, general mobilization. We can also use it to stretch the muscles a little bit. And it does rotation, so we can take it and rotate the spine through. So it does all three range of motion of the cervical spine. And it's all very comfortable and very effective. It also does distraction. So we contact the area, and the bottom of the table will pull the segment where we contact apart, create a negative distal pressure. We've had this table now for about a month, and we've got great response from our patient. Everybody feels that it's very comfortable and very effective treatment. Everybody we've used down loves it so far. Now we're going to have Dr. Tyler explain how the lumbar segment works.
All right, so flexion distraction in either, whether it be the lumbar spine or the cervical spine, what's happening as, the pieces are falling away, of course you're creating flexion, but it also creates a decompressive type of force, a very gentle force that's going to help decrease the intradiscal pressure. Okay, so you're creating kind of a negative pressure inside the disc. If you have a herniated disc, okay, what that means is there's a jelly center of your disc that gets herniated out. When you create a negative pressure, it kind of sucks that material back in, helps calm down the disc, decrease inflammation, and is going to help with, if it's in your neck, any radicular symptoms down your arm, or if you're in your low back, any problems down your leg. Okay, so for the lumbar spine with lumbar flexion distraction, you can do the same kinds of things. Okay, contacting the segment, we can go into flexion. Okay. We can add in lateral flexion with this. Okay, so a nice little rhythmic, comfortable action here. Go both sides, and this is great because a lot of times somebody has a tight, low back muscle. Okay, we can really stretch that muscle out with this, and it's great because they get to totally relax. Right, they're totally relaxed. I get to stretch that muscle. Feels great. And everything's to the patient's tolerance, okay? Very comfortable. Here we can also add the axial traction here too, okay? So as we do a little flexion, I can make that bottom piece kind of pull away. It's going to add more decompressive action at the spine there. Okay? So you can also mobilize the thoracic spine, okay, by using that the traction there, the axial traction. So what we'll do, you can contact the thoracic spine, okay, and kind of gently mobilize the thoracic spine, okay, through here. As I'm creating axial traction, I'm doing a gentle mobilization to the thoracic spine. Another really awesome feature about this, okay, a patient with scoliosis. So a person with scoliosis, their spine's kind of twisted, okay? And what we can do here with this table is kind of create a compensation to where we would, in a sense, untwine the spine, okay? So now they're neutral, and we can apply the traction type of forces or the mobilizations as would be appropriate, okay? A very comfortable table, okay? Patients are loving it. And if you have any questions, be sure to stop in we'd love to help you in any way we can. Thanks.